Minister, the Accident and Emergency Department in the hospital in Galway, I'm sure you're very familiar with it. In plain English, could you just tell me where that's at? When is planning permission going in for it? Before the 2016 election, the former Taoiseach in Kenny said it wasn't fit for purpose. The former Taoiseach and Taoiseach in waiting, Deputy Varadkar, said it wasn't fit for purpose. The current Taoiseach said it's not fit for purpose. And really, between feasibility problems, business case design cases, I have no idea where it's at. Perhaps you could tell me when planning permission is going in, or has it gone in? Thank you.
Thank you, Deputy, and I'd like to acknowledge your ongoing advocacy for this essential piece of healthcare infrastructure in the region. I had a very productive meeting with the Sale2 Group a few days ago in relation to ongoing projects at University Hospital Galway, including this project, and discussion on elective facilities for Galway and for the region. I'm happy to say this project for a new emergency department at University Hospital Galway, which is part of a larger development incorporating maternity and paediatric services, will be included in the capital plan for 2021, along with funding to progress the business case for the elective hospital. The design for the main block, incorporating a full fit-out for the Women and Children Service, has been finalised, and a cost-benefit analysis is to be updated for this development. The design for a temporary emergency department, which is to be constructed, has been signed off in the last week. This is to enable work to clear the site for the main block development. A procurement process is being progressed as part of this project, and it is expected that these works will commence in Q1 of 2021. That's for the temporary emergency department facilities. Other site enabling works are ongoing in preparation for the main emergency department and Women and Children's block development, including road and services realignment. COVID-related winter works for the emergency department are in process and expected to be completed this month or January.
Minister, I asked for a response in plain English. Where is the planning permission at? When will the planning application be submitted in relation to the Accident and Emergency Department in Galway? Back in 2017, Minister Harris at the time told us a new ED for UHG is currently being designed with a view to planning for construction being provided as part of the 2017 Capital Plan Review. This is a hospital that serves almost 1 million people from Donegal down and includes 6 or 7 counties. It is not fit for purpose, the whole hospital. I wish I had more time to go into that, and there should be a brand new hospital in Merlin Park, not just an elective hospital which is planned. So I'm asking you once again now, when, after talking to the health executive and after the years of delay, when is planning permission for the accident and emergency going to be submitted to the City Council for approval? Garmagat.
Thank you, Deputy Minister Donnelly.
Thank you very much. Deputy, I will get you a specific answer to that. It's not contained, that specific question is not contained in the answer, in the question you submitted. In the question you submitted, you were looking for an update on the totality of the works, and I hope I've endeavoured to do that, but I will revert to you very quickly with what the timeline is on this additional specific question you've asked about the submission of the planning permission. What I can say, Deputy, in regard to the question around an elective hospital or a new hospital, I had a very constructive meeting with the Sale2 Group this week. They have a plan which would incorporate a more ambitious project than simply an elective day case hospital, which is what was currently under consideration. It includes inpatient beds and additional operating theatres and so forth. And my understanding is they would be very favourably disposed to that being on the Merlin Park site, as you say. That's something that we are now progressing. And I can tell you that only this week the department have had a report in on all of the potential sites where this really important development could take place. But specifically to, I think, Deputy, the emergency department, I believe the most important piece of information as to when this is going to start is that it is being included in the capital plan for next year. That hasn't happened before. It's very, very important work.
Minister, my question was specifically what engagement you had in relation to the plan to develop an emergency department. Given the history, it's quite obvious that planning permission is the main thing. I have a slightly different opinion. In fact, I believe a brand new hospital should be built on the 150 to 180 acres of Merlin Park Hospital, and both hospitals should be used as sister hospitals, but I'm no expert. But the options appraisal did recommend a brand new hospital, and the decision then was to take a little bit of that, an elective hospital, and build in a Merlin Park. if there's change on that, I welcome that, Minister. And if you're moving down the road of having a brand new hospital to serve the million plus and the rising population, I very much welcome that in Merlin Park. But I'm really tired of the script of feasibility studies, business studies, and looking at it in a hospital that is not fit for purpose. And it seems to me that it's been driven by certain elements in the medical community, in fact, rather than a proper appraisal for the need for a new hospital, which the options appraisal has gone some way to do. But if we go along this way, we'll have a new hospital built before an accident and emergency. And it seems to me to make sense to build a new hospital and not have parallel buildings and a waste of money. Thank you.
Thank you, Deputy Minister. Final reply.
Thank you for that, Deputy. In defence of the University Hospital Galway, I would have to say I believe it is fit for purpose. I think they do exceptional work. I visited there myself when I was in opposition, and they do exceptional work. Deputy, the proposition of elective hospitals is one that is being deployed in Cork, in Galway and in Dublin. It's international best practice, and it is going very well where it is being deployed. Tallaght, for example, just within their own area, have now secured an elective-only site. And the idea is that you separate out scheduled and unscheduled care, and when that is done, it is met with very good results. I take your point on a more ambitious plan than an elective hospital, and indeed the Sale to Group share that, and that's the detailed discussion we had earlier on this week. With regard to the emergency departments, I would just finish on one positive note, Deputy, which is you and I in opposition and many others last year and in previous years pushed very hard around the trolley counts and the number of people, particularly older people, waiting sometimes for days on trolleys, including in Galway. I'm glad to report that so far this year, we're in the second week of December and it's still early days, but so far this year, whilst there's still about 90% of people coming to emergency departments and about 90% being admitted relative to last year, because of the good work done on the winter plan, the €600 million plan, including investment in Galway, the trolley count is at less than 30%. Week for week compared to last year, and for many of those who are on trolleys for shorter and shorter times, they are in more appropriate conditions suitable to the COVID environment.
Thanks, Minister. And we're moving